Well, the pandemic is causing a lot of strain on mental health.
As we see more places reopen and larger crowds, more people are feeling some level of anxiety. And Dr. Michael Moreno is a psychiatrist with the Cook County Health, and he joins us to talk about coping with that anxiety. Thank you for joining us, doctor. I find it interesting, you know, so many of us have been cooped up that we want to run out, but that's not the case with everybody. What have you been hearing, doctor?
Certainly, there are a big group of us who are excited to get back to some version of new normal, but I have a large group of patients who are very anxious about returning to either the workplace or social settings. So it's a big situation for some of us.
And what's the anxiety rooted in? Is it just, oh, all of a sudden this is a lot of stimulation, a lot of people around, or is it something perhaps a little deeper?
Well, I think for many of us, it's just that we've been locked up for so long in the house that it's strange to go out and, you know, to go to a restaurant and see people's faces again. I mean, it's a jarring experience, and there's going to be some level of reacclimation to that.
So when do you start worrying when that level of anxiety is just too much? Is there a timeline, or what are some of the pointers that we should watch our loved ones if they are suffering that?
Sure. Well, I certainly think that, you know, anxiety in and of itself is a natural human phenomena that is helpful to us. The problem is when it becomes overactive and prevents us from doing things that we need to get done. If you are, you know, struggling to leave your house once you've been vaccinated to go to doctor's appointments or to do things that would be reasonably safe and acceptable and within the guidelines, if you're finding you're having difficulty sleeping, you're so anxious all the time that you can't focus on other things, you're more irritable. Those are all sorts of signs that maybe you should be speaking to a professional.
Well, returning to crowds, I guess, is one side of the pandemic anxiety. The other side, I guess, would be coming out and saying, well, gosh, you know, I'm fearful of doing this and I'm fearful of doing that, or maybe I'm not fearful enough. Does it work both ways?
Certainly. I do think that, you know, as we move towards a higher and higher percentage of the population being vaccinated and we kind of gently go back into those social settings, I think for you as an individual, you have to acknowledge your own boundaries. And if you don't feel comfortable being in a mixed group where there may be some partially vaccinated, unvaccinated, and fully vaccinated people, you have to, you know, hold steady. But the flip side of that is true as well. Just because you're at dose 2 weeks out, does not mean you should not be following guidelines and recommendations by the CDC.
All of it very true and very real. Dr. Michael Moreno from Cook County Health, we appreciate it. I remember seeing some old pictures of Lourdes and I sitting, you know, a foot apart from each other like we used to do, and that in and of itself gave me a little anxiety.
6 feet away still. All right, thank you, doctor.